across these dispatch boxes, and it will now be in the bill. And because the point that he raised was the correct one, and we therefore took action. Likewise, the bill has been drafted alongside and with contents put in it from the Welsh Government, the Labour Welsh Government, the SNP Scottish Government, and the multi-party administration in Northern Ireland. It is a true cross-party effort. He asked about advice for those who are ill but can't recall whether they came into close contact with the Honourable Member for Mid-Bedfordshire. The answer for that is to call 111 and to ask the questions and then get the clinical advice and follow that advice. And the advice may be different for people in different circumstances. And so when people see others having been recommended by 111 to follow certain advice, they should follow that advice because it takes into account a clinical judgment based on the information that's provided to that clinician. We will, of course, as I've repeated many times, be guided by the science. He asks about, some voices asking whether the appropriate moment for further action is now. Of course we keep action under review all of the time, and as I said, the Prime Minister is chairing a Cobra tomorrow. There are some voices that are saying that we should not base our response entirely on the science, and I think that those voices are wrong. And he asked about differences with other countries. He mentioned Spain, but there's others. The truth is, different countries are in different stages of this. The point is that we will do the right thing at the right time. And there are some countries that aren't fully following the science, but I'm not going to criticise them because I think in responding to a pandemic like this, everybody is doing their level best. He asked about money. There was a very significant increase in funding, £6 billion for the health, NHS and social care system. It's very important. This is for social care too. We want to make sure that the social care system has everything that it needs to respond to this crisis, because we entirely understand both the strains on the social care system should a large proportion of the population fall ill, but also the importance of the social care system, because that's where so many vulnerable people either reside if they're in a care home or are supported. He asked if we have to wait for the spending review for any top-up. The Chancellor made quite clear in the budget that we will not. He asked about the CQC. The CQC have already published a statement today saying that they are relaxing some of their requirements and taking into consideration the impact of coronavirus, and I welcome that. They are, of course, independent. And he asked about the public health grant budgets, and as I made clear yesterday, those budgets are going up in real terms in every single local authority area, and the precise details will be set out very, very shortly.
Jeremy Hunt.
Thank you, Mr. Speaker, and I would like to thank both front benches for the highly responsible way that they are approaching this crisis, which I think does show Parliament at its best. And I want to thank the Health Secretary for his role in getting those very generous words for the NHS in the Chancellor's speech this afternoon, which have been widely welcomed across the NHS and much needed. The Chief Medical Officer says that you have to be pretty optimistic to think you could contain the virus in this country. The Deputy Chief Medical Officer says she thinks that we may hit the peak in the next fortnight. We now have more reported cases in this country than there were in Wuhan province when they went into lockdown. We know that he will rightly follow the science, but could I ask him to give his judgment to the House as to whether he thinks we still can contain the virus in this country, and if not, whether he expects to move to the delay phase very soon so that families up and down the country can start to prepare their loved ones for any precautions they might want to take.
I want to make two comments in response to that. The first is that I just want to slightly correct the point about the Deputy Chief Medical Officer, who said that in the next couple of weeks we may see the numbers starting to rise fast to their peak. We do not expect numbers to peak in the next fortnight. We expect numbers to continue to rise after that. And the peak would be in a matter of a couple of months rather than a matter of a couple of weeks. This is a marathon and not a sprint. On the second point that he raises, of course, the World Health Organization this afternoon declaring that this is globally now regarded as a pandemic does indicate that they think that this virus will spread right across the world. And that has a significant impact on the way that countries around the world will now take forward their plans. Of course, this is all within the plan that we set out, an expectation that this may well happen, and we'll be discussing that at Cobra tomorrow.
Dr. Philippa Wood.
Thank you very much, Mr. Speaker. I would echo our good wishes to the member for Mid-Bedfordshire. I welcome the declaration to keep Parliament open, but surely we should be looking at core functions. We should be looking at who comes into the House, what we do in the House. And I have to say I was a bit disappointed to have several hundred of us jammed into voting lobbies on Tuesday. This is just not a good idea. So there are ways of how we work that would still allow Parliament to stay open. With cases having increased by 13 times outside China in just 2 weeks, it has, of course, been declared by the WHO as a pandemic. But they do describe being concerned at levels of inaction. They call for quicker and wider testing so that milder cases are diagnosed quickly, isolated, and the spread reduced. Obviously, we've seen the speed of change in northern Italy over a matter of a couple of weeks. So should we not be thinking about the delay phase? Containment and delay are a continuum. It's not a switch between one and the other. And to see leisure events, large leisure events, still continuing, they are not critical. So should we be decreasing those? Do we know yet whether children are spreaders? We know they don't catch it, but do they spread it? Because that would be central to any decision about closing schools. And obviously closing schools would have an impact on NHS and social care staff. I welcome the announcement in the budget about funding to support people on sick pay, but I wonder if the Secretary of State could clarify whether this will be provided to people who do not have sick pay in their contract, because that's exactly who we were concerned about when we raised this. How quickly will all three devolved governments hear about the extra funding they're going to get, because it's urgent for them to take action as well? There has been talk about bringing doctors back from retirement. So is there discussion with the General Medical Council about relicensing doctors? Is there discussion about providing Crown indemnity for doctors who have maybe retired within the last year or 2 years? The UK is now already outside the European Centre for Disease Control. So will the government now at least rethink leaving the pandemic early warning and response system?
Thank you very much. The Honourable Lady asked some important questions about how Parliament will function. Matters for how we work are, of course, for Parliament, for the Leader of the House, the Speaker, the Commission, all guided by the science, and they are in constant contact with Public Health England to get the very best advice. Of course, when we're voting, if we are not symptomatic, if we don't have symptoms, then this disease passes in the very, very large part from people who have symptoms. So what really matters is making sure that as soon as people have symptoms, potentially of coronavirus, they get in contact with 111 with Public Health England. She asked for more testing. We are absolutely ramping up the testing capabilities, and have been commended for the approach that we're taking by international bodies. She mentioned the WHO. She asked about children. The good news, one of the good pieces of news about this virus is it does appear to have a much, much less significant impact on children. She asked about the GMC and indemnity. Absolutely, both of those issues will be addressed in the bill. And we're working very closely with the GMC. And she also asked about collaboration and work with the European Union. We still remain in the European Union data transfer capabilities, although most of this data is being transferred, frankly, is being published. We're being as transparent as possible. This week we brought out a new website to be transparent as possible about all the cases in the UK, and most European nations are taking exactly that approach.
Can I just say to help members, I expect to run this for an hour from now, and that should accommodate everybody. Steve Bryan.
Thank you, Mr. Speaker. And just taking the Secretary of State back to his point about a real national effort and to the point that he raised last week about the supermarkets helping get supplies to elderly and vulnerable constituents, many of whom can't get out, and right now we don't want them to. I just wonder whether he would join me in paying tribute to the army of volunteers across this country in community shops such as the Hursley Community Shop in my constituency, which told me today of the service that they're running for elderly parishioners in getting essential supplies to them, picking up prescriptions for them. It's a brilliant example of the big society, remember that, doing its bit to help this country get over this terrible time.
Gosh, that's a blast from the past. That phrase was invented about almost exactly 10 years ago, and he's quite right, though, that this is a national effort, and community shops can play a huge role in helping people to get the supplies that they need, the groceries and other supplies. You know, there's been much discussion of supermarkets, and I'm glad to say that the vast majority of supermarkets are playing an absolutely incredible part in this national effort, and we're working very closely with them and have been for some time. But our community shops will be right embedded in those communities and often know who are the people who are going to need the most support and have those personal relationships. And so long as they're following the public health advice to ensure that the people they're helping are also kept healthy, then I think that they have an important role to play in our national effort.
Thank you, Mr. Speaker. Can I just press the right honourable gentleman on the issue of the Atletico Madrid fans who are in Liverpool at the moment in a crowd of 54,000 at Anfield? There's about 3,000 of them who've travelled. Schools and colleges are closed in Madrid and public gatherings of over 1,000 people banned because there's a cluster of 782 coronavirus cases and there have been 35 deaths. Now that we've got a pandemic, is it really sensible for that to be allowed to continue? But both the government and UEFA have told the Liverpool Echo today that it's not up to them to take action. So who is it up to? And is it really sensible for fans who couldn't watch their team at home to be able to travel to Liverpool and watch their team play with 51,000 locals? Is that really sensible? Yeah.
Well, of course, it's for public health, England, to make advice available and to give guidance, and we will always follow the scientific advice on what makes the biggest impact. But the interesting thing, if you listen to the scientists, is that sometimes the things that may feel intuitive to us as lay people, that we think they have the biggest impact, don't in fact have the biggest impact. The measures that we are taking and proposing to take, for instance, looking at asking for people who have symptoms, however mild, to stay at home, we are aiming at the things that have the biggest impact, and there are some things that feel right but don't have an impact at all. And that's why it's so important to follow the science and what Public Health England say.
Dr. Luke Evans.
Thank you, Mr. Speaker. Primary care clinicians are expected to collect QOF data. This can be time-consuming and take them away from their clinical work. Will he consider suspending QOF data?
We are looking to reduce bureaucratic burdens on primary care and on GPs. We were looking at that anyway, but we've accelerated that work because of this outbreak. And, of course, we've moved to a principle of digital first in primary care as well as with outpatients. If you can, unless you have clinical reasons not to or practical reasons not to, then all consultations should be done by telemedicine.
Dan Jarvis.
Thank you, Mr. Speaker. I'm grateful to the Secretary of State for his statement and for all the work that's going in to keeping the public safe. In conversations with colleagues in South Yorkshire today, there's been a specific concern raised about the guidance for GPs for personal protective equipment. There have been some issues relating to the resilience of the social care sector. But can I just again very gently push him on the issue of the public health grant allocation? I very much welcome the fact that the Secretary of State has said that there is going to be an increase. But I'm sure he will acknowledge that it's in everybody's interest for our directors of public health to have the knowledge of precisely what their budgets will be sooner rather than later.
Yes.
Thank you, Mr. Speaker. That was very quick. I'd like to associate myself with the remarks made by the Secretary of State, and I do wish our colleague the very best and that her family also recover as quickly as possible if they succumb to the virus. My constituents in mid-Derbyshire have developed a test to test for the virus. They are selling it all around the world, but in this country we are not using it. It costs £5 to test it. It is working, and it gives a definition within 10 minutes of the test. So it's a quick, cheap way to do it. Please can I urge the Secretary of State to ask the Department to investigate it and to make sure that we're using the most effective test that we possibly can.
Yes, absolutely. My honourable friend has brought this to my attention before. We have done research into it, and we're working with over 24 commercial companies who have tests of this kind. And in fact, I had a meeting on this today.
Manira Wilson.
Mr. Speaker, I welcome the Secretary of State's focus now on social care. Could he clarify how much of the additional spending in today's budget will be going into social care? Will PHE be issuing protective equipment to care workers? And also, his statement refers to adult social care. There are many sick children in this country who are reliant on care, and will he be ensuring that children's needs are not overlooked? I did write to him about this matter earlier this week, so I'd welcome clarification.
As she knows, there's guidance coming out this week. She's right about the importance of protective equipment, and of course we're taking that into account. In terms of money, the Chancellor did set out that there will be more money available if it's needed in social care, and I expect that it will be. And he set out a total of up to £5 billion for the NHS and social care, but saying his door was open should more be needed. These are all very important considerations, and the guidance will be out very shortly.
Greg Clark.
Thank you, Mr. Speaker. I welcome my right honourable friend's determination to base his actions on what he calls the bedrock of the science. He'll be aware that the World Health Organization China Joint Mission Report drew particular attention to the importance of the rapid expansion of detection and diagnosis as a way to prevent illness and death. The number of tests, daily number of tests in this country has been relatively stable over the last few days. In fact, fell between the 7th of March and the 10th of March, while the number of cases increased. So can my right honourable friend assure the House that the right number of people are being tested, and in particular the expansion of testing that he announced yesterday? Perhaps he can say when that will translate from capacity and be reflected in the actual number of people being tested.
Very important consideration. As I said, the number of labs doing the testing has gone already from 1 to 12, and we're working with 24 companies, more than 24 companies, on further testing capability. We're rolling out a big expansion of testing. And the critical thing also is to ensure that it's not just the testing, it's the whole pathway from somebody feeling sick through calling 111 to being tested and then getting the test result back, and getting that entire pathway right as the number of tests goes up is the critical thing we've got to do.
Meg Hillier.
Thank you, Mr. Speaker. I want the Secretary of State to update us on the thinking about what will happen if this does continue as is projected for schools, and if schools close, what particularly will happen to children on free school meals whose parents massively rely on that to keep their children well fed.
She sets out one of the many reasons why there are downsides to closing schools. There are significant downsides, especially because of the knock-on consequences it has for the amount of staff available for critical public services, including the NHS and social care. And so there are many considerations you have to take into account if you close schools. It's why we have no plans for a mass closure of schools. Of course, individual schools sometimes will be advised to be closed, but because one of the saving graces of this virus is that it doesn't have a big impact on children, it means that there are fewer benefits to closing schools, and she sets out some of the downsides.
Steve Baker.
Thank you, Mr. Speaker. Would he elaborate social distancing? What would it entail, and in particular, what would it entail for more vulnerable groups like older people?
Well, there are different types of social distancing. There is what is essentially case isolation, which is where somebody has symptoms and asking them to self-isolate. At the moment, if you have moderate or heavy symptoms, then you should self-isolate. And we've talked about, at the right time, going to self-isolation, staying at home for people with mild symptoms. There's also, of course, the need to ensure that older people and vulnerable people for whom this virus has a bigger impact, to make sure that they can get the right advice on self-isolating, and it's something that we're working on. But here, timing really is critical, because the evidence of past epidemics and past crises of this nature shows that people do tire of these sorts of social distancing measures, and so if you start them too early, they lose their effect, and actually it is worse. So the social science and the behavioural science are a very important part of the scientific advice that we rely on.
Speaker, one of the questions in the public's mind will be the degree of resistance acquired by those who have contracted the virus and then recovered. Now, I appreciate this is more a question for his medical and scientific advisors than directly for him, but could the Secretary of State give us any information on the degree of resistance acquired by those who've been through the virus and come out the other side?
I asked the Chief Medical Officer this precise question this morning, so I can report to him that the Chief Medical Officer says that the answer to this question is that the degree of resistance is deemed to be very high, especially in the first year or more afterwards, for similar coronaviruses, and therefore likely to be very high for this one. So that is good news, that it is highly likely that once people have got it and recovered, then they're going to be okay. And that's obviously good news for people who've had it, including our honourable friend, the member for Mid-Bedfordshire.
Sir Desmond Swain.
I've received a large number of representations to pass on to him. But am I right in thinking that the one thing he's not short of at the moment is advice?
You know, this is supposed to be an easy question, but actually, my right honourable friend is completely wrong. I would rather have the advice. I would rather go through 100 ideas, 99 of which we've already looked into, to find the one that we hadn't thought of, than not be bombarded. So send them on.
Hilary Benn.
Mr. Speaker, earlier this week, the Secretary of State told the House that the NHS requires more ventilators. He will be aware that 2 weeks ago today, Italy had the same number of confirmed cases as we have. And he will also be aware of the great pressure that ICUs and hospitals in Italy are under. Can he tell us whether the additional ventilators that he is seeking will arrive with the NHS in time to cope with any rapid increase in the number of critically ill patients who require breathing support?
Well, I'm afraid to say that that isn't how we're thinking about it, because that implies a perfect world in which things are available and not in demand right around the world. So our approach to ventilators and to the staffing up, because obviously you need trained staff to operate ventilators, else they're dangerous, is to get our hands on as many as possible and to train up as many people as possible, because we think that we are going to need as many as we can get our hands on. So there isn't really a calculus here of demand and availability. It is just that we're trying to buy as many as we can get hold of.
Tom Tugendal.
First of all, pay tribute to the way the Minister, his team, Public Health England and the whole NHS are dealing with what is frankly an unprecedented situation. I'm hugely grateful to them all. May I ask if he is working with our right honourable friend, the Foreign Secretary, on keeping our diplomats and envoys safe abroad and giving them the advice they require. And may I also ask what he is doing to work with the World Health Organization to make sure that we are limiting spread as much as we possibly can around the world so that we are not infected back again afterwards.
He's right that my right honourable friend, the Foreign Secretary, along with the DFID Secretary, are working on this very hard to try to make sure that through use of DFID funds and through use of the judicious use of other British assets around the world, we can try to slow the spread elsewhere too. And of course, both the consular support for UK citizens overseas and for our government employees overseas is absolutely critical.
Abdul Khan.
Thank you, Mr. Speaker. Today, I was deeply concerned to learn that the public health information is not being shared in any language other than English. Given we live in a wonderfully multilingual society in which 4 million people, including myself and other honourable members, are non-native English speakers, will the Secretary of State explain why information is not being provided in any other language? And does he agree with me that it is in all our interest and for every single person, no matter their language skills, to understand what they need to do in order to protect themselves and others from this virus?
Of course we will provide guidance in other languages than English. We're developing this guidance at speed, and I can commit to him that we will make that available as soon as we practically can.
Dr. Andrew Morrison.
Can I commend my right honourable friend for the sure-footed way in which he's approached this, and the honourable gentleman, the member for Leicester South, for his balanced and measured response. The Health Secretary knows very well that the problem with ITU and intensivism isn't so much the kit, it's the people. What is he doing now to ensure those clinicians within the service who are in non-acute specialties are given the skills that they need in order to deal with what may be coming?
Well, as he knows, we're not only inviting and encouraging recent retirees and leavers from healthcare back in, and we'll provide for some of that in the bill, but also making sure that as we change what is effectively a big change in the case mix in the NHS to do fewer elective operations and to do more focused on respiratory diseases and coronavirus, of course, there will be a retraining exercise to go on as well.
Chris Brown.
I completely agree with the Secretary of State about keeping Parliament open, and I'm grateful for the work that he, yourself, Mr. Speaker, and the Leader of the House have done to make sure that that is the case. Can I ask him, however, about something that I didn't fully understand from what the Chancellor said this afternoon? As I understand it, if Wales wants and needs extra money for the health service to deal with coronavirus, it will get it, whatever amount is needed. I presume that also applies to social care budgets in Wales, which my local authority is already very worried about. But why doesn't it apply to all the other measures that which are meant to support the economy through this difficult period? Why doesn't it apply to council tax and business rates?
Oh, well, he asks and presses me on a question that is not in my departmental area, and can I just apologise, Mr. Speaker? I would rather get him the right answer than give him the wrong answer now, so I'll make sure that we get back to him.
Ashley Alfred.
Thank you, Mr. Speaker. My honourable friend for Mid Bedfordshire has been playing a pivotal role in supporting our East Kent hospitals, and I'd like to add my good wishes to her family and her staff. Yeah. Areas like mine in Dover and Deal are on the border with another country. With a global pandemic now announced, can my right honourable friend update the House on any additional steps being taken internationally to manage transmission risk between countries, such as between our country and France?
Yes, we're increasing the support available at ports, all ports, including airports and seaports like in Dover, and making sure that better information is available, including in multiple languages, to those who are arriving, specifically and importantly about because no matter who's here, We want to make sure that they know that if you are ill, what you should do is call 111, because this virus travels from human to human, not from people of one nationality to within that nationality. It doesn't see that distinction.
Bill Ribeiro-Addy.
Mr. Speaker. Will the Secretary of State accept that keeping Parliament functioning as normal with public visiting is simply irresponsible? As others are encouraged to cancel large meetings and events and unnecessary travel, we instigate large meetings, host events and receptions, and travel from all across the country. Vectors, I heard an honourable member call it last week. Now, festivals have been postponed, concerts postponed, football games postponed, but it's business as usual here, even holding our MPs' surgeries. And as we continue to meet hundreds of people weekly, I'm concerned that we're potentially spreading the virus. My biomedical training tells me that a number of members in this House probably already have the virus. And I'm genuinely concerned about older members of this House and older members in our constituency and those with underlying health conditions. So will the Minister implement testing for all members of this House and staff of this House, not just for any special treatment reasons, but simply because of all the people that we meet and we have been meeting in the past few weeks? And will he agree that we should have electronic voting or automatic pairing for any member who may wish to self-isolate themselves?
As I said in the statement, I'm delighted that Parliament is staying open. There are, of course, considerations around procedures and how the House operates that are rightly a matter for the Leader, the Speaker, the House of Commons commissions, and every single member of this House to express their view. She has rightly put her view firmly on the record. And that is a matter for so long as the public health advice is very much taken into account and it's based on that advice, as far as I'm concerned, that is something that I'm sure those decisions will be got right, led by you, Mr. Speaker. The one thing that I would say and just respond to is that calling for testing for everyone is not going to help. And that's because the test is not reliable for people who are not symptomatic. Right. This is why testing at the airport, for instance, which several people have called for, it's not effective. And some of the countries that started it stopped it because it leads to a load of false positives if you do temperature testing, because you might be ill with something else, and that complicates the system. Or it leads to lots of false negatives, with the test returning a negative even though somebody's ill, because they don't have enough virus in their system yet to be symptomatic and for the test to pick it up. So testing of people who do not have symptoms is not reliable and it is counterproductive, and so we won't be doing it.
Thank you very much. Mr. Speaker, he spoke absolutely rightly of the chronology of feeling ill, dialing 111, and then going to take the test itself. But can I echo the concerns of the self-test capability? He's obviously pointed out the difficulties in the accuracy. I'm concerned that about 1/5 of the UK workforce might be off ill, of which many of them may not develop the full symptoms themselves. Can he look at, please, the ability of us advancing a capability to self-test in the nearest future as possible, because that will eliminate many of the workforce going off unnecessarily?
Well, of course, absolutely. In fact, there was a very big conference in London today on precisely this issue. We're working with dozens of companies on it. We'll work with anybody and scour the world for a solution as he describes. Just one other thing I wanted to add is he talked about how I described the way that what people should do if they feel ill and call 111. Also, going to the 111 website is really, really important, because that takes pressure off the call centres and many people can get the answers they need without talking to someone.
Speaker, can I bring the Secretary of State back to his discussions and liaison with supermarkets? I'm aware of at least one supermarket chain who's already said to local food banks that they are cutting their orders and limiting what they're providing to food banks. Could you please raise this with the supermarket chains to make sure that those who need food aid provision in the country, the most vulnerable and the needy, get what they need?
It's DEFRA that's leading the work with the supermarkets now, and so I will ensure that DEFRA get that message and take that up.
Thank you, Mr. Speaker. The vast majority of people who contract this disease will be able to self-isolate and recover at home. In a small number of cases, they'll need hospitalisation. And as the number of people infected increases, so could the serious cases increase as well. So could my right of friend say that those people that have to be hospitalised will have to be isolated? And what plans are there then to increase the number of beds that will be available in hospitals on isolation units?
We are increasing the number of beds, and also by moving away from some of the elective activity, making more beds available. But I just want to pick him up on one thing, which is that as and when this virus becomes widespread, isolation becomes less important than ventilation. The normal flu procedures are that keeping several people who all have the same flu in one room, in one ward, is absolutely fine because they can't infect each other because they've all got the same disease. So isolation is vitally important in the contain phase. It is still important in delay, but as we get through to mitigating the impact, the need for isolation facilities is less important.
Thank you, Mr. Speaker. The Chancellor's announcements earlier today were very welcome, but I wonder if the Secretary of State could help cast a little bit more light on the announcement about employment support allowance, because there are millions of people, as he knows, who don't qualify for statutory sick pay, and the effectiveness of self-isolation and doing the right thing relies absolutely on many people who don't have standard employment contracts being able to be confident that if they self-isolate they won't lose out. Yet the employment and support allowance system works in retrospect with delays and is quite bureaucratic. Could you say a little bit to us tonight about how that is going to be mitigated so that those who aren't on standard employment contracts will know that they can do the right thing and not suffer?
Yes, we'll be publishing more on this in very short order because the changes needed in this area, some of them will be in the bill, but some of them are in secondary legislation, so we can go at a faster pace potentially than the bill. The ESAC, as it's known, it only comes in after 7 days, and bringing that down is an important part of the reassurance that she seeks.
Thank you, Mr. Speaker. And can I thank the Secretary of State and all his team for the way that they've handled this so far, and also for the statement this evening. And can I thank as well the Secretary of State and those others for the way they have continued to communicate in a clear and very accessible way. And as the spread of this virus affects people's lives in more and more ways, it's really critical that continues to happen, that fake news cannot be allowed, cannot be given a breathing space, if you like. So can the Secretary of State assure us that there is a clear plan about how to communicate, that the whole of the public will know exactly where to go for information when they need it?
Absolutely. This is right at the top of the agenda, and tackling fake news is incredibly important. The major social media platforms, search engines have already risen to this task, and I pay tribute to them, which I have in the past been known not to pay tribute to them, and sometimes quite the reverse. They have absolutely risen to this task, and we will keep on it. But of course, the information that we provide to the public will have to evolve, both as we learn more about the disease and as we move through the plan. For the moment, the absolute core message is that people should wash their hands.
Secretary of State, are we reaching a stage where people, if they have any form of cold, should be self-isolating? Because we've all known people who've had colds, some of them more severe than others, but they've been able to be confident that that's not been coronavirus. But now it's becoming more prevalent. But how can they be sure? It's going to create a lot of confusion. So are we reaching that stage where, as the Prime Minister alluded to the other day, that you may have to self-isolate if you have any symptoms?
We're not there yet, but we're moving towards it. That's what the Chief Medical Officer set out at the press conference on Monday, in part for exactly the reasons he sets out.
Aaron Bell. That we are following the science, including the behavioural science, and I also hugely welcome the cross-party approach we are taking.
Does the Secretary of State therefore share my concern that celebrities, including some politicians on social media, are advocating a different approach, which they are completely at liberty to do, but does that risk undermining the national cohesion we need to raise to this challenge?
Secretary of State.
Yes, I've seen some of the noises off. I merely commend everybody to base the decisions and the judgments that they're making on science rather than politics.
David.
Mr. Speaker, I thank the Health Secretary for his update to the House and continual updates that he's been bringing to the House. A constituent of mine's partner suffers from cystic thrombosis and other related illnesses, and they require daily treatment that's to do with cleansing, and that includes the alcohol wipes and the gels. But obviously, because of the panic buying that's been taking place in some of the shops, that they've been to the shops and haven't been able to purchase these items, and this can obviously go on to have a serious underlying health issues for them. Is there any other protective factors that the government can put in place or work with supermarkets to try and manage this?
Yes, absolutely. It's really important. We do have some supplies of these sorts of things, both in the supply chains and in some cases within the chains of the shops themselves. And we're working with the shops to make sure that people can still get availability of things that can be quite critical to their care. It's something that we're working on both with DEFRA and within the department, particularly, and with the NHS, particularly in relation to pharmacies as well, to make sure that we get the right kit to the right people who need it.
Oliver.
And the Health Secretary for doing a difficult job in trying circumstances extremely well. And likewise, all the staff at Kettering General Hospital who are working their socks off to ensure the hospital is fully prepared. The only easily understandable benchmark our constituents have to judge the scale of this thing is seasonal flu. So can the Health Secretary tell the House, on average each year, how many people catch seasonal flu and how many people die from it?
That is a great question, to which I don't have the answer in my head, but it is a matter of hundreds of thousands in the first instance and thousands in the second.
Civil Roberts.
Brilliant. We know that social care workers play a key role in supporting people to recovery and in alleviating pressure on clinical staff, yet today's budget offers no clarity on new money, and care providers are still awaiting a draft social care strategy. If the Minister rightly seeks cross-party agreement, what steps is his government taking to bring forward a draft strategy for discussion on social care? And also, what discussions is he having with Welsh Government regarding social care capacity?
Well, of course, the delivery of social care is a devolved matter, and so we'll be bringing forward guidance. We're working with the devolved authorities on it to make sure it's as consistent as possible, but social care policy is different in the four nations, and so obviously we'll have to take into account those differences.
Gary Sandbrook.
Thank you, Mr Deputy Speaker. On Sunday, Birmingham will play host to one of the largest St Patrick's Day parades in the world. And so can he assure me and the people of Birmingham that he will do everything he can to issue the right guidance as quickly, effectively as possible, but so people can make sensible decisions when it comes to the use of public transport and attending mass gatherings?
Yes, absolutely. I will. I can assure my honourable friend that. For now, the guidance is to wash your hands, and if you sneeze or cough, to make sure you catch it in a tissue and throw the tissue away.
So more.
Thank you, Mr Deputy Speaker. Can I thank the Secretary of State for always keeping the House informed throughout this crisis. I think he's doing his job well, and it's good that he's coming on a cross-party basis with the support of people right across the United Kingdom. I've been contacted by lecturers and school teachers in my constituency to ask what discussions the Secretary of State is having with the DFE, with the exam boards and with the devolved administrations about what could happen moving forward as we approach the examination season. Because the points being made to me, particularly by FE lecturers, that it isn't just children who will face exams in the coming months ahead.
This is an important consideration, and I discuss it with the Education Secretary and with the Schools Minister regularly. We're keeping it under review. Obviously, it would, in the best possible world, we'd want all exams to go ahead as always, but we also must keep people safe.
Mike Wood.
Mr Deputy Speaker, may I pay tribute to the amazing work of NHS staff
who are working to support patients who contracted COVID-19 and to prevent others from catching it. What can be done to minimise the risk to those amazing NHS workers?
This is a really, really important part of our work. Not only extending the rollout of PPE to all the primary care settings, GPs, by the end of this week, that is on track, and making sure that everybody in community settings as well in the NHS gets support. But crucially, this is going to be a tough time for people who work in the NHS. The demands on them are going to be very significant. And the nurses, the doctors, and all of the staff in the NHS do an extraordinary job all of the time, but they are going to be called to be the front line of our response in a way that, many haven't seen before. And so I thank them in advance, and I think the whole House would want to thank them in advance for the service that they're going to give.
Wayne David.
I note what the Secretary of State said earlier about different approaches in different countries. But I've been recently approached by the Professor of Visual Neuroscience at Cardiff University, Professor Jonathan Erickson. And he says there's a great deal of what we can learn from South Korea in particular. So will the Secretary of State give a commitment that he will keep an open mind as to how our strategy might approach this problem, given what's happening in other countries and their lessons?
So absolutely. We're daily looking at how every country in the world is responding to try to find the very best response. That is part of the science. And the SAGE process, the Scientific Advisory Group on Emergencies, that is the body that comes together to bring that science together, is constantly reviewing this because we simply want to have the very best response we possibly can, and that's what we base the judgments on.
Elliot Colburn.
I also would like to welcome the measures taken in the budget to fight this virus, but could I also pay tribute to the work of the Secretary of State and his team in tackling this. I think he's doing a fantastic job and it's not going unnoticed. Sadly, a local resident who had coronavirus passed away at St Helier Hospital in my constituency on Monday. And I'm sure my right honourable friend will want to join me in paying our condolences to the friends and family, but also he will understand there is a certain level of fear that has arisen as a result of that death in my community. So I hope he will join me in urging calm amongst the local population and ensuring people that this isn't the time to panic buy or listen to social media's rumours, but instead take the advice of the Chief Medical Officer and call NHS 111 if they need to.
Absolutely. I want to pass on my condolences to the family, to the loved ones of all those who've died, including his constituent. I know that the hospital that he works very closely with is absolutely safe and did exactly the right thing in this case. I would reassure his constituents and everybody else's the best thing to do is to follow the advice from the Chief Medical Officer, who is doing a remarkable job, and to either call 111 or go on 111 online if they have a query.
Dame Diana Johnson.
Thank you, Mr Deputy Speaker. The Secretary of State said in his statement we're working closely with the social care sector to make sure it's ready. I wonder if you could say a little bit more about some of the stories that are circulating about the use of volunteers to provide social care, and in particular the use of students.
Well, of course, there will be a big voluntary effort should there be staff shortfalls right across public service. The people who volunteer need to be asked to do tasks that fit their skill set. So if people have medical qualifications and volunteer, then fantastic, and they can go and do that and do clinical work potentially if that's right. Some volunteers will not have that sort of skill set, but there are still things that they can do, especially if people are being asked to self-isolate and not leave their homes, to make sure that they can get the what they need. So it's a matter of finding the right match for the skill set of the people who are going to help. You know, in a scenario where 20% of the public is off sick, then volunteers will be able to help to alleviate some of the inevitable pressure that brings.
Bina Pomsare.
Deputy Speaker. Further to today's budget, I've been contacted by a local authority in my constituency of Erith and Thamesmead, seeking clarification on the urgent need for further funding by one of the local hospitals. This is to deal with the immediate Cobra crisis, specifically for the social care sector. Can he explain and elaborate further what he has said so far?
Yes, of course. The needs in terms of funding for social care, as for the NHS, over the weeks and months to come, are not yet clear. So what the Chancellor did was set out an envelope, if you like, of up to £5 billion to make sure that we can now plan according to what we need to do, whether resources are constrained by what the nation has in terms of, especially in terms of people and trained people, as opposed to limited by the funding. But he also said that if we do need even more than that, then his door is open. So I don't have a specific answer to where all that money is going to be spent, which would be normal in a government announcement of this kind, and that's because we're in unprecedented circumstances. But we will, of course, be transparent and clear about how the money has been spent, and no doubt there will be a huge amount of looking into what happened afterwards to try to learn lessons, and the financial part will be one strand of that work.
Kate Green.
As more people become seriously unwell and need treatment in hospital, it will become very important that those who recover are discharged quickly back into the community. Can the Secretary of State say what work is being done to ensure smooth discharge pathways so that we don't get delayed discharges that compound the problems for the NHS?
It's a really important point, and again, I met the NHS to discuss this specific point today. It's critical that we ensure as fast discharge as possible. This is important in normal times, but when large proportions of those in hospital could, with the right support, leave hospital and be in a setting that works for them in social care, we've got to make sure that happens. The extra funding will help in this, but it's not all about funding. A lot of it's about the coordination, and people are working their level best to try to make that happen.
Darren Jones.
Thank you, Mr. Deputy Speaker. Some parents are unsure whether to send their children to school when somebody in the family household is self-quarantined. Could the Secretary of State confirm what guidance has been given to schools to deal with what would be normally classed as unauthorised absences, and maybe alleviate some of the concerns from head teachers that Ofsted will take a lenient view to absence figures in their later inspections?
Yes. Ofsted absolutely will take a lenient view of the impact of coronavirus on what's happening in schools. When it comes to the broader point about what households should do when one of them test positive, that of course is something we're considering very closely. At the moment, the number of cases is at a level that we can give individual advice to each household. It's likely that that won't be possible throughout this, and therefore we will make sure that there is formal guidance, public guidance to everybody, so everybody knows what to do.
Debbie Abrahams.
Could the Secretary of State clarify a point that was made by the Work and Pension Secretary on Monday when she said that Social Security claimants who were due to take an assessment or work-related activity would not have their Social Security support stopped? It was omitted in the group that the Chancellor talked about this afternoon. So could he clarify who was basically right? And also, could he also make sure that information is available to the deaf and to the visually impaired, because I think that is a gap as well in information.
On the latter one, I entirely agree. It goes along with the earlier point about communications in foreign languages. On the first point, I will ensure that the Work and Pension Secretary writes to her with the answer to that question.
Thank you, Mr. Speaker. Local government will have a very important role to play in working with the Secretary of State's department in dealing with this beyond social care. So when are local councils going to get an indication of extra funds they may receive? Now, the Secretary of State said that the peak of cases may come in 2 months' time. That's exactly the time of the local government elections. So will the government now give some consideration to the desirability of postponing those elections, just as happened in 2001 with the foot and mouth epidemic?
We are not proposing to delay the local government elections and the other elections, for instance, for police and crime commissioners that are happening in early May. That is not part of the proposal, and local authorities should plan as normal for those elections. If people think that they may need a postal vote, they may want to have a postal vote just in case, then I'd always advise people to get a postal vote. That is, I'm very happy for that message to go out loud and clear.
Okay.
I also commend the Secretary of State's measured approach. Are there any plans to offer specific guidance for dealing with rough sleepers and unaccompanied children, two quite vulnerable groups who, for different reasons, will pose a challenge to the authorities?
I entirely agree with him, and he's very wise to raise this. This is being led, that strand of work is being led by the Community Secretary.
Shannon.
Thank you, Mr Deputy Speaker. Thank the Minister for his dedication, and also to Mr Speaker for the vital role that he has played here in this House. Minister, history has taught us many lessons. In the pandemic of 1919, secondary schools stayed open, as did churches. Normal life with precautions in place for all. Is that the message that the Health Minister tonight is sending out to people?
I hope that the message in the decision to keep Parliament open makes clear that the institutions that are fundamental to our way of life in this country will continue through this virus. We will get through it as a nation, and then we will take this nation forward. This is going to be a difficult and challenging time for many, many people. And it will be a national effort, but this national effort will prevail, and then we'll get through.
Stephen Doughty.
Mr Deputy Speaker, I was pleased to hear what the Secretary of State had to say about the involvement of the devolved administrations, including the Welsh Government, in the legislation that's being drawn up. And it would be useful to have that clarification on funding that my honourable friend from the Rhondda asked about. But could I just ask about mutual aid between the four NHSs of the UK? So, for example, he was talking about ventilators and procuring those. Is that being done on a UK-wide basis with the four NHSs, or are they competing against each other? And what will be done in terms of cross-border needs, for example, Welsh patients travelling to English hospitals or vice versa, where the need is greatest?
The four NHSs are also working together. I discussed this with Simon Stevens, the Chief Executive of the English NHS, of NHS England, today. So that cross-border work is, of course, important, and it's something that my opposite number in the Welsh Government has raised, and as a Chester boy, I get the point. So I will make sure that we keep that level of coordination, as well as the level of coordination at the point of the CMO. Can I answer a question better than I did before, Mr Deputy Speaker? My honourable friend from Dudley asked the question about whether GPs were getting their protective equipment, and we have rolled out protective equipment to almost 100% of GP surgeries now.
Thank you.
Claudia Webb.
Thank you. Earlier, the government, through the Treasury, indicated that and announced a package of support for local authorities to protect the vulnerable during the coronavirus outbreak. Would the Secretary of State agree that a proportion of this hardship fund should be allocated to the local welfare provision so that support can be given and allocated to those who are most vulnerable and facing financial hardship?
Yes, it's a really important point, and that will be part of the provision.
Russell.
Thank you, Mr Deputy Speaker. First of all, may I congratulate my right honourable.
He's been here throughout, and it's up to honourable members to decide if they wish to catch my eye. Dean Russell.
Thank you. May I first congratulate my right honourable friend on the campaign that's been run around this. I think it's really kept the level of conversation stable and consistent throughout. May I also say that this week, sadly, we also had a constituent pass away in Watford General Hospital, and I'd like to pay tribute to that family and also to the staff that work so hard there. My question is is really around the responsibility more broadly within this place and across councils, local government and anybody in a public position. Just to ask whether my right honourable friend would agree with me that the main message we need to get out is for people to remember that at the front line of this, the most important thing they can do is wash their hands and do that regularly and do the 20 seconds wash on a regular basis. It's not much to ask the general public to do that, but it's the most frontline thing that they can do to stop the spread. Thank you.
It's incredibly important, and we've got to keep reiterating it, Mr. Deputy Speaker, even though we may have heard it 1,000 times. And I may have said it even more than that, because while there's a huge debate about coronavirus and what we can do as a country, there are some really simple things that are really effective.
Thank you,
Mr. Deputy Speaker. I have two questions for the Secretary of State, and I thank him for his commitment to keeping this place open. I agree with him, it's very important. So what guidance will he give to us to prepare for what may be necessary? For instance, possibility of having to cancel events, constituency surgery and so on, because I have staff, I'm sure most members do, who are already concerned about how they should be protecting us, but most importantly themselves and their family and friends. And second of all, what's he doing or talking to colleagues about doing for those people on very low incomes who have to self-isolate and are unable to order food through the internet, either because of lack of credit card or no internet?
So, for the first of those, the Leader of the House, the Speaker of the Commons Commission are best placed, advised by Public Health England, to come forward with guidance on the details of how this place can run should there be a significant number of colleagues and potentially staff who are unwell or self-isolating. On the second point, it's very hard to make sure that we can, from central government, reach all the people who will need the sort of support that she describes. This is best done through local authorities, and that's why we put in £500 million of a fund for local authorities, with essentially for them to do whatever they think is necessary in these circumstances.
Robin Miller.
Thank you, Mr. Speaker, and I'd like to thank my right honourable friend also for his conduct and the way he's handled this situation. Mr. Speaker, it's true of Wales that it's seen very few registered cases of the coronavirus relative to other parts of the UK, and indeed in North Wales we have no registered cases, I believe, of the coronavirus. I welcome the development by the Betsy Cadwallader University Health Board of the installation of temporary testing sites nonetheless. And I was wondering, would my right honourable friend confirm that, in fact, the Welsh Government does have access to the same advice that he does, and that they are being included fully in the preparations that he's making here in the UK?
Yes, absolutely. This is a Four Nations approach. The Welsh CMO is in daily contact with the English CMO, the Scottish CMO and the Northern Irish CMO. Indeed, they're also working with the Chief Medical Officer of the Republic of Ireland. And that the basis of the scientific advice is the same across the four nations. Although there aren't any cases, as he reports, in North Wales, I'm afraid this virus is going to continue to spread, and we should expect that there will be a case in North Wales before too long.
Peter Grant.
Mr. Deputy Speaker, I certainly welcome the Government's determination to keep Parliament open. What a U-turn from the situation we had not that long ago when we had to take them to court to keep it open. But will the Secretary of State accept that it doesn't have to be all or nothing? There's a lot of things happening in this place that are not essential to the functioning of our democracy, and which either in fact or certainly in perception create a high risk of infection. For example, why do we still have functions where food is left out in uncovered plates on a table at the end of the room without enough sets of tongs so that people have little choice but to go and help themselves using their hands? Why is it in the few occasions where we do have to divide the House that we can't already be using a deferred division system so that people go through the lobbies in dribs and drabs over a 2 or 3 hour period instead of being crammed in 300 at a time within a maximum time limit of 8 minutes? So can I ask the Secretary of State and his colleagues in government to look at some of the practices in this place, partly to minimise the chances of us becoming the carriers of infection back to our constituency, but also to give a message to the rest of the population that we have identified where our own practices fall short of the best standards of hygiene and that we are taking steps to correct that.
Thank you. Well, I do understand where the honourable gentleman is coming from, and the issues that he raises are matters for the House authorities, and I'm sure they'll have noted the comments that he's made.
John Warra.
Thank you, Mr Deputy Speaker. Newcastle Hospitals Trust welcomed the UK's first coronavirus victims 6 weeks ago now. In the intervening time, the role of Newcastle City Council public health team has become increasingly important as local cases are identified and local concerns raised. And yet they don't know what their budget will be from April. How can they plan an effective public health campaign? So will the Secretary of State at least confirm when they will be told what their budget is, and also that the increase, and there will be an increase, will increase with the duration of the crisis?
Yes, of course, because I expect this crisis to last for less than a year. I've been absolutely clear that the allocations will increase in real terms, and therefore everybody can plan on that basis, and we'll get the details out as soon as we can.
Stephen Farry.
Thank you, Mr Speaker, and I thank the Secretary of State for his actions to date. But could I ask him what further consideration has been given to UK citizens overseas who find themselves perhaps in greater numbers being required to self-isolate, who in turn find themselves in financial hardship due to that extended period, and in turn for citizens of other countries who are visitors to our country who are also required to self-isolate but maybe don't have the means for an extended stay?
Look, this is really important and quite difficult. Our general approach is that people, if they become ill, should stay where they are and be treated in the country in which they find themselves. And in fact, it comes back to the previous question, because the first 2 victims of coronavirus in the UK were not British citizens, but they were treated brilliantly by Newcastle Hospital. They were absolutely fantastic, the treatment that they got, and quite rightly so. Of course, there are cases and there are examples where we do have to support people to come back to the UK. For instance, this afternoon, a flight from California landed, bringing people from the cruise ship that had been off California. But the general principle should be that people are supported and treated where they are.
Andy Slaughter.
Thank you very much, Deputy Speaker. Will the Secretary of State review the criteria for testing? I have a constituent who has returned from the US with symptoms of the virus, who's been refused testing because she has not come into contact with a known case. Yeah. And will he say what the policy is on NHS staff wearing masks when on duty, primarily to avoid the risk of the virus being spread by undiagnosed medical staff?
I'm very grateful for the constructive tone in which he asked the question. I think this is an example of the House working well, because the honourable gentleman and I have sometimes had cross words across this chamber, but he's asked these 2 questions quite rightly. Of course, the advice given on 111 has to be dependent on the circumstances that are presented to the clinician who is giving that advice on the other end of the phone. It's really important not that I don't fetter their discretion. Nevertheless, it is important, if he comes to me with the individual case, that if he wants me to double check that they got the right advice, I'm very happy to do that. On the second point, the Deputy Chief Medical Officer had a discussion with the Prime Minister today that was videoed and put on Facebook, and in that she was clear about this question about masks, because there is not an advantage of wearing a mask if you are healthy. That is the advice from the medics here, but there is an advantage to keeping others safe if you are ill, and there are examples of when medical staff will need to wear the right type of mask to keep them safe. But the general advice is don't wear a mask unless you're advised to by Public Health England, or if you're ill, it's perfectly reasonable to wear a mask to stop infecting others. It's an act of generosity.
Liz Twist.
Thank you, Mr Speaker. Can I first of all start by thanking the Speaker and the Speaker's team and the House authorities for ensuring that this statement is signed. A concern has been raised by Action for Hearing Loss and others about the lack of information in British Sign Language. So I thank you for that. This afternoon my office was contacted by a constituent whose mother is in a care home which has been closed to visitors for what they describe as the foreseeable future. Can the Secretary of State say whether guidance will be issued to residential care homes to ensure that the proper arrangements are made for access to residents?
Absolutely. I agree with the Honourable Lady very much on the importance of sign language and signing of this session. And I thank the House authorities for arranging that, Mr Deputy Speaker. On the care homes, yes, there will be guidance, new guidance put out this week. And on the individual case, if she'll pass on the details to the Care Minister, I'm sure she'd be happy to look at it.
Matthew Hancock.
Thank you, Mr Deputy Speaker. I was contacted earlier today by a constituent who flew back in from northern Italy yesterday evening. He told me that on landing there was a complete lack of information, no staff on hand to offer any guidance, and then he proceeded to watch everyone from that flight in the main spill onto public transport. I fully agree with the Secretary of State's advice that we follow the medical science, but symptomatic or not, surely on flights arriving back from Category 1 countries, people shouldn't be met with that situation. Is that the case?
We have upgraded the response to flights coming back from Italy today. And so I do understand some of the concerns that were raised earlier in the week, and we've put an awful lot of effort with the DFT, with the Border Force, and with the airports authorities themselves, all of whom I want to pay tribute to address exactly the concerns that he raises.
I'd like to thank the Secretary of State for Health for his statement today and wish him and his wonderful NHS team well in their endeavours during this pandemic.
I beg to move that this House do now adjourn.
The question is that this House do now adjourn. Shi Anwara.
Thank you, Mr Deputy Speaker. And it is a great pleasure to be here to speak in this important debate. Whilst the budget and, unfortunately, the coronavirus crisis will take the headlines today, the climate emergency and our transition to a net zero economy remain the greatest challenges facing humanity. We will have to change many aspects of our society to address these challenges, and that includes what we drive.